And now I will give the floor to Søren Andersen and Sarah Earnshaw-Blomqvist, and they will speak on feasibility study on EU-wide and cross-border campaign on vaccination.
So, good morning. We will present the work that is. Oh, sorry. Yes, I'm too tall for this. Hope you can hear me now. We'll present the work that has been performed on feasibility study on cross-border vaccination campaigns. And we're from the Swedish Public Health Agency. I'm Søren Andersen, and with me is Sarah Earnshaw-Blomqvist. Now we'll see if I can handle this one. Yep. So the original scope of this task was to look into the possibilities to perform coordinated EU-wide measles catch-up vaccination campaigns to tackle common immunity gaps linked to the development of a cross-border IIS, and this was part of work package 5. And it turned out already in the beginning that there were some difficulties with this task and this scope due to a number of reasons, difficulties in identifying common immunity gaps, lack of comparable cross-border data on the reasons behind low coverage, and so on. And also, as has been mentioned before, the heterogeneous nature of vaccination programs. So, and then in addition, of course, the pandemic came with all that followed with that. We could have had and utilized the work that has already been presented now by Hanne Dorte and Tamara, but that was also part of the work package. So we were working in parallel. So at this stage, we could utilize some of the results for this work package. So with that as a basis, the scope was widened to look into possibilities to inform future cross-border vaccination campaigns in general, and with the more specific objectives to review what has already been done along these lines, to consider what can be gained by teaming up, to document the perceived facilitators and barriers, and to identify themes for future cross-border collaboration. And we started with meetings with representatives of WHO Europe, ECDC, to inform and to set the stage for this work. We then collected data through a survey that was performed in collaboration with our collaborators at Work Package 8. They will present their work later on today. But our part of that work will be presented soon here. We then also performed workshops both in conjunction with the Rome meeting and with face-to-face workshops and then also digital workshops, a number of digital workshops in the end of last year, with the participation of a number of countries in the JAV and also from other stakeholder organizations. So with that, I will hand over to Sarah to present the results, and that will also lead into a panel discussion on the possibilities and challenges based on the data that we have found. So, Sarah, please.
Now I need to move the microphones down a bit. I'm a bit shorter than Sarah. No problem. Okay, can you hear me? Yes, good. Thanks very much for introducing the changes to the scope from what had originally been planned, Sarah, and the methods. And now I'm going to go on to presenting briefly the results before coming into the panel discussion, which is going to be the most interesting part, I think. So the results from the cross-border questions, which were circulated as part of the Work Package 8 on vaccine hesitancy, showed that only 9 of 28 countries in the EU and associated countries that participated in the Work Package 8 survey reported having worked across border on vaccination campaigns. And what we found when we asked questions like, for example, have any interventions to address barriers and drivers to vaccination been done as a collaboration with cross-border partners, or have any studies to barriers and drivers of vaccination, including literature reviews or sharing of data, been done as a collaboration with cross-border partners, was that there was a tendency for more Central European countries to respond in the positive, whereas the northern countries tended to be more responding in the negative. We do think that this is an underestimation because some could even describe the JAV as a cross-border collaboration. And we think it also depended on who in the vaccination programs were responding to the surveys. Jonas maybe we'll go into that in a little bit more detail, but I think in some countries it was a sort of collaborating group from the vaccine programs that responded to the survey, whereas in other countries maybe it was one individual who responded rather quickly because it was in the middle of the COVID pandemic. But this gives us, in any case, a broad indication of the fact that there's not that much collaboration going on across borders on vaccination campaigns as it stood at the time of the survey. In terms of the more detailed results from the survey, in terms of what these collaborative efforts across borders might look like, the participants reported on research groups, a method for tailoring immunization campaigns to specific low coverage populations or individuals. This is where certain countries participated in the WHO TIP tool, for example, platforms for exchange, such as neighborhood collaboration on vaccine coverage and acceptance in the Nordics, for example, and the big European-wide annual vaccination campaign that WHO leads, the European Immunization Week. We also asked about what could be the benefits of collaborating cross-border and what type of incentives would encourage more cross-border collaboration. And in terms of the benefits, participants in the survey raised issues such as sharing of experience on studying vaccine hesitancy and best practice between countries, sharing of data, and collaboration in reviewing the scientific literature, which can be incredibly time-consuming. And then incentives would be many people raised this issue about platforms for exchange, making it easy to collaborate across borders. For example, workshops or telephone conferences, but there are also many other types of platforms. We also asked about how knowledge from cross-border collaborations has been implemented in terms of the vaccination programs. And these are some of the examples that participants gave. So improving the communication between healthcare workers and vaccinees, measurements for vaccine acceptance, training of vaccine program administrators, vaccine registries and reminder systems we've talked about today, high-level advocacy for political and financial commitments. You need budget to be able to make actions happen. Vaccine decision tool and conferences and seminars. So this really broad range of actions where data from cross-border collaboration has been used. There are also a lot of difficulties reported in terms of the cross-border collaboration, and the team analysing the results from Work Package 8 developed this table, which divides up the difficulties into 3 main themes. So the social cultural differences, like language and culture, historical context, trust in authorities, the institutional differences, like the health system, the objectives of health departments, differences in IT systems, and different vaccines or vaccine targets, and resource differences. For example, that doesn't apply so much now, we can have digital meetings. You don't need to travel anymore to a meeting with your colleague across borders. But the financial burden and lack of data, now we've solved that problem. And so I think when designing cross-border campaigns, it's really important to take account of the local context in order to avoid campaigns becoming more burdensome than beneficial. And then we were asked also by the Commission to include reflections from COVID vaccination. So what kind of platforms have we seen for EU-wide collaboration or cross-border collaboration during the COVID pandemic? And there we've seen, of course, this very successful EU mechanism for purchasing of COVID vaccines, which is a wonderful example. But we've also seen the regular EU technical exchanges through both the EU Health Security Committee and the ECDC NITAG platform, which has really blossomed. And we've also seen this WHO community of practice on behavioral and cultural insights, where we're developing and sharing data, real-time data on vaccine acceptance, and also discussing how to use this data for implementation in terms of risk communication. And then we've seen some neighborhood collaborations as well, supported by the EU. So we heard that in the Baltics, there has been a specific collaboration on vaccine supply where one country had a shortage. And also we heard that in Romania, Hungary, Germany, and Austria, there has been a collaboration supported by the EU on reaching low vaccination groups. And some smaller countries in particular have requested more support. And then also we've heard about the development of a number of very relevant EU-funded projects under the Horizon 2020 and the third EU health programme that can provide really essential learnings for us to take forward as part of this work. So overall, we've identified in our final report 13 themes where we think that value can be gained by cross-border collaboration. And that's based on the analysis of the participant statements from the workshops as well as the results on the survey. And we think that these 13 themes can be used as an operational hook for really anybody who is thinking about designing some kind of cross-border vaccination campaign. I'm going to present very quickly on the 6 of the themes, some of the examples that were given, and then we're going to go into the panel discussion, which can cover any of the 13 themes. So, for example, one of the themes is low vaccination populations. How do we target and increase vaccination coverage in some of these low vaccination populations, and how could this be a theme for working across borders? And then we think, well, there are some common issues across borders, like, for example, with migrant workers or diaspora that you find in many of the same diaspora in the various EU countries. Also, maybe there's issues around unknown vaccination status of foreign workers and their families. And there was even a suggestion that the children may be their vaccination checked before they start school. In terms of communication strategies, there are a lot of ideas for how we can share best practice across borders, from sharing patient stories, which is so hard to find and research. For example, the wonderful and very moving story of the HPV cervical cancer patient, Laura Brennan from Ireland, that has been used across borders. How we can, common strategies for reaching social media users, such as mothers on Facebook. Common approaches to explaining the risks of not vaccinating children. We talk a lot about the benefits of vaccination, but could we have some common messages around what are the risks of not vaccinating? Also monitoring the social media in terms of anti-vaccine discourse and disinformation. I think that's covered in Work Package 8, so I won't dwell on that too much. And also how we work with the media to communicate the benefits of vaccination. Neighbourhood and twinning issues has come up a lot. So how can we have more platforms for exchange and support in small groups? Sometimes I think people feel in the big EU-wide group, it's quite difficult to have a meaningful discussion or to get your points across. But in a small group of context similar countries, this can be very helpful. Comparable data on vaccine acceptance. This is a really big one. And I think that we're making some progress in this area through the COVID pandemic, but sharing tools and experience on behavioral and cultural insights, as well as the medical and epidemiological aspects of vaccination is really important for being able to compare data and identify trends across border. And then these coordinated literature reviews that I've mentioned that are so time consuming and resource consuming. How can we collaborate more on doing these reviews of the international scientific literature? And in particular, for example, identify new practices for the real-time social media monitoring of questions and disinformation, because there are so many different groups doing research into this area now. And the training of healthcare workers, where quite a lot of work has already been done across borders. Some of the issues raised were such as that healthcare workers are not sufficiently aware of the need to check vaccination status of adults, that there needs to be much more vaccinology and communication skills in curricula for healthcare workers, that there are groups of healthcare workers and students that are anti-vaccination, and that there is this general concern over unvaccinated healthcare workers, a lot of the issues that we're very familiar with. So here is a visual of all the 13 themes that we've identified that can be valuable for cross-border coordination. They're adult vaccination, working with pharmacists, political advocacy, training of healthcare workers, technology tools, communication strategies, low vaccine populations, training risk communicators, neighborhood twinning initiatives, coordinated literature reviews, one voice key messages, stakeholder engagement, and comparable data on vaccine acceptance. So there's lots we can do.